There aren't very many old buildings in Panama City anymore. Economic growth has led to a nationwide property boom. When Franklin Morales drives through the city, he's surprised at how many new buildings he sees. The skyline changes almost monthly. Panama is now one of Latin America's fastest growing countries. Franklin Morales is 28 years old. He attended university and gained experience working abroad. He's now using it back home in Panama, but not to earn big money.
The
country has another side, ongoing poverty. People who lack access to healthcare and education. There are still fundamental problems, human dignity and adequate nutrition. So we think there's room for improvement and a need for action, and that we young people must take over responsibility. After all, we make up the majority of the population.
Nearly 40% of Panamanians are under the age of 25. Most are educated in outdated and overburdened schools and universities. Here, the emphasis is on discipline rather than encouraging students to think for themselves. Franklin Morales and his friends refuse to accept that. In their free time, they organize regular workshops in schools. Everything is worked out together, and nothing is compulsory. The pupils learn soft skills, taking responsibility, working in teams, and making decisions. For many of them, that's completely new.
We think these are valuable tools teenagers can acquire at 14 or 15 when many are deciding what to do with their lives. We want to help them as early as possible to plan their careers and studies.
The prospects for young people are not rosy, despite Panama's economic growth. Franklin Morales and his fellow campaigners want to change that. There's still plenty to do in the health sector as well. People who can't afford patient contributions have a problem. In Panama City's largest hospital, blood is in short supply. Surgery is only scheduled for patients who've donated their own blood in advance. In rural areas, the situation is even worse. Sometimes doctors are at their wits' end because there's not enough blood to treat patients. 28-year-old Gabriel Rebellon asked himself what could be done. He's a friend of Franklin Morales and a doctor. He too felt something had to change. On this particular day, he's off work after finishing a night shift. But he always looks in at the blood bank to see what's needed.
My twin brother and I were born prematurely, and we needed blood transfusions in the pediatric hospital. Although there were people who helped us and donated blood, it was hard for my parents back then. Many years later, when I went to university to study medicine, I noticed the situation was still the same. That was when I decided to found Sangre Panama.
Rebellon's organization is called Blood for Panama. He visits companies, talks with employees, and tries to persuade them to donate blood regularly. He spends a lot of time campaigning for donations on top of his work as a doctor. And he's glad of every person he's managed to convince. It's good to get support for his volunteer work from kindred spirits, though. So he and other volunteers have joined the Global Shapers Network. They're connected worldwide with thousands of other young people committed to similar causes. They give each other advice and mutual support in Panama and elsewhere in the world.